Hello dear students, I hope you have enjoyed your journey through the modules that we have done so far. Now we come to the last module of this course, which is Recent Technological Advances in Modern Medicine. The author of this module is Dr. Sarojini Jadhav, Professor and Head General Surgery at Government Medical College, Aurangabad. And I am Dr. Payal Bansal and I will be presenting the module. And I'm Chair Professor in Medical Education at Maharashtra University of Health Sciences. So technology in education, especially Gen Z, who is most familiar with technology we use today. So you are the Gen Z who is most familiar with the technology that we use today. The world is changing, of course, as we all know, and technology helps us to keep pace with the changing world. With the help of incorporating new technological modalities, patient care has improved by leaps and bounds. We have gathered here to discuss the impact of recent technological advances in the field of medicine and how it impacts healthcare at large. The objectives of this session are to enumerate the different technologies used in the field of medicine, to describe recent advances in medical education, in lab diagnostics, radiology, surgical management, and medical management. We will then describe the role of technology, or we would rather ask you to dwell upon what can be the role of technology in homeopathy and describe the impact of this modern technologies on the field of homeopathy. As you know very well, technology has advanced drastically over the past years. We have come a long way from using simple hourglass to wristwatches to smartwatches that we carry on our person every day. The smartwatch is an example of how technology is benefiting us in our day-to-day life and healthcare. At the touch of a button, we can find our steps taken, our oxygen saturation, and even get a glimpse of our ECG readings. Isn't that awesome? Let us begin now with what is medical technology. Medical technology is the practical application of modern biomedical technical modalities to aid the diagnosis and management of medical care. Technology has made science reach out and conquer worlds. The application of such technologies in the medical field has proved to be a boon for humanity. The processes and treatments which used to take weeks on end now can be done within days or hours. But let us ask ourselves, why do we need technology while dealing with human lives? Number one, it facilitates medical education. If you remember, all the studies in our school times were on a blackboard with the help of a chalk. Now things have changed drastically, as you've seen during COVID, how technology made education available at all our homes, on our screens, even without the need of textbooks. Even missed lectures can be recalled and revised. Advanced techniques have allowed for early and precise diagnosis. So besides education, we are able to use it for diagnostic purposes. Advances in the management due to early and precise diagnosis have been improved to reduce pain, hospital stay, cost of treatment, and better recovery and rehabilitation. Medical records, which were all manually kept before, are streamlined now, and hours of paperwork can be done in few minutes nowadays. Advances in technology have also made it easier to store and retrieve the medical records and save a lot of space and natural resources with wide accessibility. Better delivery of healthcare, second opinions, knowledge of a novel procedure with excellent outcomes can be shared just by the click of a button with colleagues all over the world. Now let us see what are the various technologies used for teaching and learning. In medical education, you have simulation labs. It is a lab designed to provide an immersive learning experience for healthcare practitioners and students. I'm sure some of you have had the experience of learning in simulation labs, things like basic life support and some simple procedures which can be life-saving or beneficial in emergency situations. So simulations lab allow learners to practice and develop these skills without harming the patient. Mannequins are available to practice the intubations, venipunctures, and all the things that you are required to do as general practitioners. Now 3D anatomical dissection is also available. Because of lack of cadavers, dissection is a thing of the past. We have made advances whereby every layer of the body can be dissected and the cavity also can be visualized with the help of 3D virtual dissection. Cost, of course, is an issue right now, but that can be gradually reduced over a period of time. And of course, now new generation is also looking at artificial intelligence and virtual reality, which have allowed for interactive teaching and learning as well as assessment. Diagnostics, technological advances in physiology have made a lot of test methods simpler, which were once very cumbersome and invasive. For example, pulmonary function tests, nerve conduction studies, pathological specimen processing, radiology advances now allow non-invasive visualization of patients' anatomy and pathology. All these are revolutionary, and the field having grown by leaps and bounds to have used X-rays and sound waves to visualize body tissues and anatomy as well as pathology. Commonly used digital modalities, as we all know, are X-rays, ultrasounds, CT scans, PET scans, etc. The surgical field incorporates modern technology like robotics, minimally invasive techniques, endoscopics, lasers to perform a surgical procedure with as much accuracy as possible so that there is minimum morbidity. I don't know your first years, so morbidity means spending more time in the hospital, taking longer to recover, taking longer for the body to heal. So all those have been much shortened with the help of technology. So medical advances can be classified in this way. They can be diagnostic as well as they can be therapeutic. So diagnostic means like continuing monitoring systems, like Holter monitoring, continuous ICP monitoring, 2D echo, etc. Therapeutic examples are like insulin infusion pump, ventilators, defibrillators, hemodialysis, and pacemakers. The objectives of this session are to enumerate different technologies used in the medical field, to describe recent advances in medical education, lab diagnostics, radiology, surgical management, medical management, and to describe the role of technology in homeopathy and the impact of modern technology in homeopathy. As you know very well, technology has advanced drastically over the past years. We have come a long way from using a simple hourglass to wristwatches to the smartwatch that carry on our person every day. The smartwatch is an example of how technology is benefiting us in our day-to-day lives and healthcare. At the touch of a button, we can find our great steps taken, our oxygen saturation, and even get a glimpse of our ECG readings. Isn't that wonderful? Now, coming to what is medical technology. Medical technology is the practical application of modern biomedical technical modalities to aid the diagnosis and management of medical care. Technology has made science reach and conquer worlds. The application of such technologies in the medical field has proved to be a boon for humanity. Processes and treatments which used to take weeks now can be done in days and hours. But let us ask ourselves first, why do we need technology while dealing with human lives? First, it facilitates medical education. If you remember, all study in school that we did was on a blackboard with the help of chalk. Now, things have changed drastically. As you've seen during COVID, how technology made education available to us in our homes, on our screens, without textbooks. All the bulky books, voluminous books, and researches are now all available at the fingertip. Even missed lectures can be recalled and revised. Advanced techniques have allowed for early and precise diagnosis. Advances in the management due to early and precise diagnosis have been improved to reduce pain, hospital stay, cost of treatment, better recovery, and rehabilitation. Streamlined medical records are now possible. Hours and hours of paperwork can be done in minutes. Keeping medical records is a huge task, as you know, and keeping them in physical form in hard copies needs a lot of space. So advances in technology have made it easy to store and retrieve these records, even though they are decades old, saving space and natural resources with wide accessibility. Better delivery of healthcare, second opinions, knowledge of a novel procedure with excellent outcomes can be shared with colleagues all over the world. Now let us see what are the various technologies used for teaching and learning. In medical education, we have simulation labs, we have skills labs, we have 3D anatomical dissection, and we have artificial intelligence. As you all understand, Skills Lab or Simulation Lab provides an immersive learning experience for healthcare practitioners and students. In Skills Lab, mannequins are available where you can practice procedures like intubation and venipuncture. 3D anatomical dissection. Because of lack of cadavers, we have missed out on dissection so many times. But now that is a thing of the past, because with the help of a virtual dissection, where even the cavities can be visualized in a 3D manner, they can be studied n number of times by n number of students. So, however, these are costly at present, but with time, cost will come down and it will result in more wider use of this technology. AI and virtual reality also have allowed for interactive teaching and learning as well as assessment. Now, coming to diagnostics, we have the biochemical labs and assays, we have PFTs and nerve conduction tests, we have pathological specimen processing and radiological advances. So all of these, which were not available earlier, are now possible because of the advances made through technology. Radiology allows the visualization of patient's anatomy and pathology in a non-invasive way. Radiology uses various rays and sound waves to visualize body tissues and anatomy as well as pathology. Commonly used modalities, as you are all aware of, are X-rays, ultrasound, CT scans, MRI, PET scans, etc. The surgical field incorporates more modern technology like robotics, minimally invasive techniques, endoscopies, and lasers to accurately perform surgical procedures with minimum morbidity. Now, medical field advances can be diagnostic and therapeutic. Diagnostic means some examples like continuing blood sugar monitoring system, Holter monitoring system, continuous ICP monitoring, and 2D echo. Therapeutic include insulin infusion pumps, ventilators, defibrillators, hemodialysis, and pacemakers. I'm sure you don't quite understand the details of these, but you have heard about them from time to time, either in relation to your relatives or any other patients that you may have known of. All these modalities of common knowledge even to the lay persons. So all these modalities we are familiar with even though we are not a medical practitioner or a medical person. So here's a picture of Skill Lab. You can see some students practicing endotracheal intubation and suturing, which is, of course, endotracheal intubation is life-saving, and suturing is the very basic skill which everyone who gets qualified with a bachelor in surgery is supposed to be able to perform. So here are some images of how artificial intelligence, 3D anatomy, etc. and enhanced visual devices are used for education purposes. Virtual reality is another exciting and upcoming modality for teaching, learning, and assessment. At the click of a button, any medical individual can access intricate systems and the details of the human body and correlate the same with clinical knowledge acquired from the wards. In this video, you can see a student using such virtual medical reality, and an assessor is grading the student based on the clinical skills acquired. Now let us take a look at the lab diagnostics and advances in that region. Clinical laboratory techniques to analyze blood, urine, etc., complete blood count, liver and renal function tests, testing other body fluids for various enzymes are all now possible through very sophisticated instruments which are the result of advanced technology. Earlier, these were done manually using very old-fashioned, you could say now, methods like chemical and manual titration. And now, with a single device, you can do it all. Now, coming to immunoassays, you may not understand this term right now, but then I will encourage you to go and see what it means and read a little more about it. What immunoassays do is combine an antibody or enzymatic target recognition element with fluorescent, luminescent based readout to allow detection of a broad range of complex biomarkers. These are used to quantify test results, for example, titration for typhoid, viral load quantification, etc. Therapeutic drug monitoring like digoxin, barbiturates, etc. Hormonal studies. So these are the various areas in which immunoassays can be useful. Then pathological technological advances. These include tissue pathology identification, so histopathology, processing, biopsy, true cut biopsy, and frozen section. So in the olden days, patient had to be admitted and undergo an invasive surgical procedure to take a biopsy. As you can see, we have modern techniques now which are pathology technological advances. In olden days, patient had to be admitted and undergo an invasive surgical procedure to take the biopsy of a suspected tumor. As you can see, we have a modern technique known as a true cut biopsy needle. With the help of this, we can quickly retrieve a tumor specimen sample and send it for histopathology without need for undue surgery. This reduces the overall morbidity of the patient and reduces the need for admissions without affecting the outcome of the diagnosis. Conventional biopsy reports take 6 to 7 days when taken by incision or by a true cut method. When we are operating on cancer patients, for example, we want to know whether there is residual malignant tissue left behind or not, or if there are lymph nodes which were involved during the surgery, so that we can remove more tissue. In such a situation, we need immediate diagnosis of cancer cells in the tissue. So for this, frozen section is a fastest method to identify the tissue and is used when rapid tissue diagnosis is essential, as shown in the picture. So operating surgeon sends the biopsy specimen, which is immediately checked by the physiology through frozen section machine, and such slide is then visualized and the diagnosis is confirmed. Now coming to the microscope. Microscopes are instruments which help us to examine the tissues at the microscopic level, so called, and help us to determine what is the pathology within the tissue. Conventional microscopes have been used since 1590 and have undergone various modifications since then. The first picture shows the microscope as you might have been using. The 5-headed microscope, which is a recent modification of the conventional microscope, is used at big institutions where simultaneous visualization of the specimen by multiple people is possible for expert opinion or for teaching students simultaneously. The digital microscope, with recent advances, it has been possible now to project the tissue slide on a bigger screen, and that can be shared with other pathologists as well as clinicians for discussion and for achieving final diagnosis in difficult cases. So various methods to identify the tissues are histopathology, biopsy, FNAC, frozen section, immunohistochemistry, in situ hybridization, flow cytometry, laser microdissection. Now these all words may sound very difficult to you, but over time you will gradually understand what they mean and what information they provide for the patient. Now immunohistochemistry combines histological and immunological and biochemical techniques for the identification of specific tissue components by means of specific antigen-antibody reaction tagged with visible label. So some of the benign conditions where we are finding it useful are like detection of viruses like Epstein-Barr virus, cytomegalovirus and rubella, detection of protein hormones in histopathological diagnosis, and for malignant conditions we find it useful for nasopharyngeal carcinoma, breast carcinoma, pancreatic and salivary gland tumors. Now, radiology has also evolved over the years. An X-ray is a packet of electromagnetic energy that originates from the electron cloud of an atom. An X-ray beam collides with body tissues and casts a shadow over the detector, which is then read by the X-ray machine. On the left side, you can see an X-ray beam source and an individual standing to get an X-ray. On the right, you can see a normal chest X-ray followed by an X-ray of the fractured lower limb and upper limb, and X-ray depicting gaseous distension of the bowel loops. So all this was traditionally possible after the X-rays were invented. Now digital X-rays have eliminated the need for unnecessary wastage of the X-ray films and cassettes, and it has a high degree of sensitivity. The X-ray films are no longer required and processing is much quicker, and it can be stored and shared with the help of digital media. Ultrasonography, as the name suggests, uses sound waves. It is used by radiologists for tapping of abscess, percutaneous nephrostomy, etc. So these are all complex surgical procedures which as first years you may not still understand. But the people who use ultrasonography are radiologists for making a lot of non-invasive diagnosis and also for draining abscesses and amniotic fluid, and for doing ultrasound guided biopsies. By the anesthetist, it is used to give regional anesthesia. By cardiologists, it is used for performing 2D echoes. By surgeon and physicians, it is used for pleural tap for effusion ascitic fluid in the abdomen and for liver abscess also. Then coming to mammography, which is another advancement which has revolutionized the early detection of breast cancer. The mammography plates also allow tissue abnormalities like calcification, asymmetry, architectural distortions in the soft tissue of the breast to be assessed in much detail. Biopsies can also be taken. Now, all of us have heard about the CT scan. CT scan has made radiological imaging very easy and user-friendly. It gives a 3D view of the body, and the images are very, very much detailed. So, whereas it is useful in head injury, in conditions of acute abdomen, like when there is an intestinal perforation or ischemic bowel disease, or if there is intestinal obstruction. It also helps to diagnose muscle and bone disorders and to pinpoint the location of a tumor, infection, or even of a clot. Here you can see extradural hematoma in the parieto-temporal region with a hemorrhagic contusion in the left parietal area. Then there is a CT of the abdomen showing hepatic tumor. There is a CT urography showing the area around the kidney with a left hydronephrosis. Then there is this other fourth one is the CT angiography of a bilateral lower limbs showing the vascular supply in the lower limbs. Here you can see a 3D CT reconstruction of a skull fracture. Now coming to PET, that is positron emission tomography, is a type of nuclear medicine procedure that measures the metabolic activity of the cells of the body tissue. It is a combination of nuclear medicine and biochemical analysis, used mostly in patients with brain or heart conditions and cancer. It is used to detect leftover or residual tumors after chemotherapy or radiotherapy. Now here you can see an MRI scan. The full form of MRI is the magnetic resonance imaging, and which is based on radio waves. So what are the advantages of MRI? It improves the detection of lesions. It improves lesion characterization, uses non-ionizing radiation, and can be therefore performed in pregnancy. It can be repeated without any fear of radiation exposure and thus has got more repeatability. So now the MRI is much more being used compared to the CT scan. However, it has some disadvantages, like it has longer scan time and may make the patient a bit uncomfortable and claustrophobic. It is more expensive. It is very noisy. Cannot be done in patients with metallic implants. Now you may have heard the term interventional radiology. So intervention and radiology, the two words are very self-explanatory. So the radiologist can now incorporate many clinical diagnostic and treatment methods along with the help of radiological imaging. Some of them are stenting, angioplasty, clipping of an aneurysm, then CT guided biopsy and tapping, and ultrasound guided removal of fluid, that is what we mean by tapping, and angioembolization and drug infusion. Coming to technological advances in surgery. New OT designs. Now, you may have heard of modular operation theatres. Actually, you may not have heard of them unless some of you happen to know medical professionals or frequently interact with them, and particularly surgeons. And there are hybrid OTs which allow for interventional procedures to be converted into open surgery. Then surgical equipment. Basic surgical instruments are often aided with technology to advance the surgical methods. For example, you all must have heard the term stapler, which is used in bowel anastomosis and many other surgeries. Then in endoscopy, we are able to see inside the human body with the help of an endoscope, and now almost every part of the human body has become accessible in that way. Some of the areas that are accessed are larynx, so laryngoscope, esophagoscope, bronchoscope, thoracoscope, esophageal-gastroduodenoscope, laparoscope, proctoscope, sigmoidoscope, colonoscope, cystoscope, ureteroscope, and arthroscope. You can go and find out now what all these terms mean, and they are quite self-explanatory. Now here, another technological advance for surgeons is the electrocautery. So during surgery, there's a lot of blood loss. It is unavoidable because to reach a particular tissue which requires your attention, you have to pass through so many other tissues. So earlier, this used to take a lot of time. The surgeons used to face huge challenges in preventing the blood loss. So this has been simplified by the electrocautery, which means with the help of electrical current, we are able to achieve coagulation of the tissues, and that arrests the bleeding. Then now there is minimally invasive surgery, which is another technological advance. So with the help of that, we are able to access the human body without making a very big incision. That allows smaller scars with better cosmesis. It gives a much wider exposure of the inside of the human body with the help of a scope. It is less painful. The hospital stay becomes short of the patient, so they're enormously reducing the cost of treatment, and also it leads to early recovery. This is an example of a laparoscopic gallbladder removal, also known as the cholecystectomy. A little bit now on advances in urology. So previously, the surgeries for kidney and ureter stones were performed in an open method, and there was a lot of blood loss, there was pain, there was high chances of infection. Scars were there of big incisions, and also a number of days was spent in the hospital. Now, with the help of keyhole small incisions, the stones are removed. That is known as percutaneous nephrolithotomy. There is also extracorporate shockwave lithotripsy for small stones in kidney and ureter. So these have radically changed the field of urology. Then you've all heard of lasers, which is light amplification by stimulated emission of radiation. So these are removed by surgeons for removal of tumors, for cosmetic treatments by ophthalmologists. They provide better precision, less bleeding, and it is a day care procedure, thus avoiding the cost of spending time in a hospital. Again, robotic surgery also is something which now common people are also familiar with, and now I'm sure you have also heard of it. It has a surgeon's console, which the surgeon operates in the same room but away from the patient, and patient side cart is there on which the interactive robotic arm controls are there from a console. Robotic surgery, I think you've all heard of robotic surgery. It consists of a surgeon's console that is typically in the same room as the patient, and patient side cart with 3 or 4 interactive robotic arms, which are then controlled by the operating surgeon from the console. The arms hold the object, and the robot performs the function of the arms by holding scalpel, scissors, graspers, etc. And the system always requires a human operator, which is the operating surgeon. Then intensive care is another area where technology has made a lot of advances. Oftentimes in intensive care, there are critically ill patients and who need ventilator support and continuous monitoring. Have you ever been to an ICU? There are so many monitors which are consistently assessing and checking a patient at all given times. The ventilatory support is usually by a mechanical ventilator with a fixed set to deliver a set amount of breaths to the patient. All this technology has helped us to keep a rigorous round-the-clock watch on sick and critical patients and markedly improved the survival of these patients by continuously monitoring things like blood pressure, pulse, respiratory rate, ECG and other things. Now these are simple instruments. The first one is for measuring blood pressure manually, and the second one is to measure blood pressure electronically. And this I'm sure all of you have used, even though you may not have the opportunity for the previous so many advanced and sophisticated devices which we have shared with you. But even a simple thing like blood pressure monitoring has undergone a lot of change due to technological advances. Then IV fluids you can see in this picture, but it is very difficult to give drugs in fixed amount over fixed duration through these IV sets. An infusion pump which helps to deliver drugs in specific doses at specific time. again eliminating the use of monitoring, manual effort, and in fact it even reduces errors which might result due to human error. Now this is how the pulmonary function tests were done in the olden days, and now, so we all know what the ECG is. It has revolutionized cardiology and the treatment and detection of cardiac illness. Wave changes are noted as abnormalities in the electrical pattern of the beating heart. So not only to the cardiologist, but it is the backbone of treatment for, before surgery, you have a patient undergo ECG to assess their cardiac status because you're going to put them at high risk, and screening of patients who are at high risk. Then for cardiac ailments, angiography, angioplasty, cardiac diagnostic procedures, ECGs, etc. For renal disease, dialysis machines. For neurology, nerve stimulators, deep brain stimulation, etc. are all examples of advanced technology. Then we have defibrillators, which are life-saving. So they are part of ICU, they are part of various regimes where it can be used by a layperson also, like the AED. So by giving a DC shock, not only after the automated external defibrillator or AED can be used by the layperson, and it can differentiate between shockable and non-shockable rhythm. So it gives DC shock only after the rhythm is identified. So it can be used, or it is being used rather, in the roadside emergencies. You may have seen it also in some of the places. Radiotherapy involves using carefully selected doses of ionizing radiation to destroy the DNA of the cancer cells. So the difficulty with this is the cost of setup and maintenance and the need for professional expertise for carrying it out. There are many other advances in different fields of medicine which are beyond the scope of this lecture. I think even this must have been a lot for you, and you can use the presentation and the slides to find out more about each of these technologies that we have shared with you. Now, what is the role of technology in homeopathy? In education, one can use the same technologies that are being used in modern medicine to improve the teaching, learning, skill practice, assessment, and record keeping. The investigative tools can be used to confirm the diagnosis and the stages of disease. And the investigations will help you understand the stages of the disease or the progression of the pathology that the patient has, and to modify even your drug response according to the progression of the treatment. After understanding the advanced treatment modalities, one may be able to refer the patients for the said treatments at the correct time. There is so much sophistication, there is so much happening in the medical field on account of advancement in technology that basic knowledge, and that's why we have put so many of these varying modalities as part of this presentation, that you will learn how these, once your awareness is there that these particular symptoms can be benefited by some technology which will be greatly reducing the morbidity in the patient, or the amount of time or the amount of leave the patient has to take away from work, or the amount of time they have to spend at home. So these radically life-changing treatment modalities have become available as a result of technology. And as a homeopath, it is good to be aware of these so that you can refer the patient for some of these at the right time. All this will ultimately lead to better outcomes for the patient. We know this was a lot, but we have the presentation for you to which you can refer to and go back to again and again and deepen your understanding about the various modalities. So this was just meant to be a sensitization talk to just bring you some new terms, new methodologies, even though they may sound very complex, but if you go back to them and you Google them, you will find the adequate information about them to understand them fully. So with this, we leave you to do a lot of reading about the technologies and a lot of introspection and inward sight to see how these can benefit the homeopathic approach to treating the patient. Thank you very much. So this was a long session on various kind of advances in technology that have revolutionized patient care in a very dramatic way and improved patient survival. It has improved quality of life. It has saved money for patients. Technology has done a lot. It has influenced the way we are educating our students and the way you all are learning also. So with all of this, now I think it was a bombardment with lot of new words. What we would want you to do is to go back to the presentation, find the new words, go back to Google with those words or any other source that you can think of, and go more deep into each of these. What will happen as a result of that is, once you understand these technologies well, you will be able to think how you can apply this to better patient outcomes. So when you know that you are treating a patient, there comes a limit and the patient is not improving, what modalities I can use to make my diagnosis better, what modalities I can use to help the patient get better treatment, what modalities I can use to help the patient get back to work more quickly. And there may be answers not available within your own field, and that is where we turn to technology, and with the help of technology, help our patients and our population at large lead better lives. So I hope this little episode of technology will trigger you to learn more and more and see how you can apply it to your own practice as a homeopathic physician. Wish you all the best. Thank you so much for your listening.